My name's Hannah. I studied at La Trobe in Bendigo and now I am an intern pharmacist here at Northeast Health Wangaratta. So far my experience has been great. I feel like we get a lot of responsibility but also still have so much support from the other members of the team. I had a placement here in my second year of my undergrad and I absolutely fell in love with the place and the people who work here, so I just had to apply here to be an intern. So an average day I get to work and I distribute to the wards, so I head up there and make sure that the ward we're looking after has enough stock for the day. Then we look at any discharges that are going to happen or do any MMPs that need to be sorted for the day. When I had my placement here I just felt so welcomed, and I knew for my internship I wanted to be around a team that made me feel supported because it is one of the hardest years that we will have to do with our study, so I wanted to be somewhere I felt that I had a good support network.
So hi, I'm Eliza. I'm a student from RMIT Bundoora and right now I'm working at Vanilla Health as an intern, which also includes my time here at Northeast Health Wangaratta, in which I spend about a third of my year. I think that being a part of a regional health service really allows you to target the members of the community who need your help the most. You're looking at patients who potentially don't have access to healthcare where they're from and they're travelling to our health service in order to seek care. I usually come here once a week to Northeast Health, otherwise I'll do my 3-week rotations throughout the year. But in that time I'm really just in charge of whatever ward I'm put onto. So at the moment it's maternity and I'm looking after stock, I'm doing discharge medication and also doing dispensing as well.
My name's Renata. I'm an intern pharmacist that's come from the University of Canberra. So an average day I'll get to work and I'll sort of work on any distributions of any medications for one of our primary wards, which is maternity or pediatrics. And then after that I'll sort of go with my pharmacist on any of the wards that I'm assigned to. And we'll work on discharges at the start, and then we'll do medication management plans and chart checks as well. Yeah, so we have our preceptor, which is Steph, and she is very helpful with just any problems that you have, or whether it be at home or at work, or if you have any sort of issues that you need to resolve. And the pharmacists that you're assigned to for the wards are also just super friendly. They're they have a lot of knowledge as well, which really does help kind of develop your clinical knowledge as well. You get lots of support, especially the technicians that can help you when it's very busy, and just the director and deputy director are also very friendly and always willing to help as well. Yeah. So because I'm from Canberra, I was looking to go rural, and Northeast Health is one of the only hospitals that kind of offers non-government funded positions, which I'm very lucky for that.